We see the right trapezius here and the left trapezius here. Very often the trapezius is said to have an upper trapezius, a middle trapezius, and a lower trapezius. But this is an artificial designation. There are no true structural fascial separations between upper, middle, and lower trapezius trap. Rather, it is a gradual transition of the fanning out of the fibers from the clavicle and scapula out to the midline of the body, from the occiput down to T12. But generally speaking, we think of the upper fibers as those that lift the scapula upward, the lower fibers as those that pull the scapula downward, and the middle fibers that pull the scapula straight across the midline toward the spine. So if I'm palpating in this area between the scapula and the spine, I will first be on skin, then subcutaneous fascia, then trapezius, then rhomboids, and then I would be on serratus posterior superior. And the extra wrinkle is the fact that the rhomboids run in the same exact fiber direction as serratus posterior superior, making it even more challenging. We are looking at the levator scapulae muscle here, going from the medial border of the scapula up to the superior angle of the scapula. And from here, this muscle runs both superiorly and a bit laterally, and it's running over to transverse processes of the cervical spine. Now, it's usually said that there are 4 slips to the levator scapulae, but this particular individual has an anomaly. This is the first slip running up to the transverse process of C1. This is the second slip here running to the transverse process of C2.